So today I'm going to be doing my research presentation on the Child and Family Traumatic Stress Intervention, CFTSI, which is an evidence-based family-focused early prevention trauma treatment. CFTSI interests me because I work with the juvenile population, and sometimes I feel like it takes a long time in treatment to reach a desired outcome. And I wanted something that was short and effective in the short term with this population. And I wanted to research something that was both trauma specific and trauma informed. CFTSI was developed by the Yale Childhood Violent Trauma Center, which is the trauma section of the Yale Child Study Center, which is the CVTC, and it provides trauma informed treatments and services to children and families. It builds professional knowledge through its extensive research, collaboration, and dissemination. So, the CFTSI program mission focuses on two risk factors: poor social and familial support, and poor coping skills after a potentially traumatic event, so after PTE. Preventing PTSD from developing is the primary goal, and the how is by increasing communication between the child and the caregivers, teaching specific behavioral skills to the child and the caregiver, and also creating a fence around the family with resources so they aren't burdened by outside factors that prevent healing after a PTE. The CFTSI has been shown to be effective in disadvantaged populations, and it's also effective in short amount of sessions. The average session is 4, and sometimes a family may need a little bit more time depending on their level of readiness, their level of mental capacity and abilities. And it takes a family approach. And it's also effective shortly after a trauma exposure or disclosure of a traumatic event. The goals are also to improve screening and identification of children impacted by traumatic stress, reduce traumatic stress symptoms, increase communication, provide skills to master trauma reaction, assess child's needs for longer treatment, and to reduce concrete external factors. So, a therapist who is implementing this type of treatment is doing this on a micro level. The therapist that implements CFTSI counsels clients on a one on one basis in a counseling setting. The therapists are working with individuals who are disadvantaged and they already have a long standing need for community support. It's implemented predominantly with lower income families where both the child and the parent have experienced complex traumas, but it can also be implemented with a wide range of incomes. The population is between the age of 7 and 18 years old, both male and female, and with a wide variety of ethnic and cultural racial groups. It is available only in English and Spanish, so the family would need to speak either of those two languages. It takes place in inpatient and outpatient treatment facilities, schools, and forensic settings. The regions have been urban, suburban, rural areas in over 11 states. And cultural issues have not been heavily written about concerning this intervention. The major components are preventing chronic PTSD and reduce symptoms of PTSD. Program key services are early intervention, helping family recognize the impact of trauma on development and greater control and mastery over symptoms before they become a part of a longer term established post traumatic stress disorder. CFTSI is a trauma specific treatment and it's not limited to one type of treatment. So a child can experience physical abuse, sexual abuse, rape, unexpected death of a loved one, a motorcycle vehicle, or multiple and chronic traumas. Program origins. It was developed at the Yale CVTC, as I stated earlier. And after 2 decades of this program responding collaboratively with law enforcement and child protective services to provide acute on scene and follow up post families experiencing a PTE, The developers, Dr. Morans and colleagues, recognized the need for evidence based early intervention that would fill the gap between standardized interventions and longer term treatments that deal with post traumatic reactions. There is a manual that describes how to implement this program, and there's training available for this program. So, what outcomes is the treatment designed to achieve, and how are these defined and measured? So, PTSD reduction of symptoms by using the trauma screening, trauma history questionnaire, adaptation of the PTSD-RI, and the mood and feelings questionnaire. Also, the CPSS is used as an outcome measure. CTFI is a trauma specific treatment that will be implemented by a therapist at the master's level that has taken a 2 day, 12-hour training. And then they also receive clinical supervision trained and experience with a trainer that has been experienced with CFTSI, weekly group supervision, and that is the minimum requirement. So the intervention is a supportive 4 session intervention. The first in the first session will be a meeting with the caretaker, 2 individual sessions, and then the fourth is feedback session with both the caregiver and the youth. Sessions 5 and 8, these provide as needed child and parent treatment together. The theoretical basis behind this is it's informed by research indicating that family support is a primary protective factor for children exposed to trauma or hostile course of parenting as a predictor of initial PTSD symptom severity. So, program evidence, a randomized control trial completed at Yale in 2009 found that the children receiving CFTSI were 65% less likely than comparison youth to meet criteria for PTSD and were 73% less likely than comparison youth to meet combined criteria for full PTSD. And there is no evidence of harmfulness. So, this is pretty much how they did the randomized control comparative. They had 106 participants. They split them in half. They gave them 2 separate CFTSI as one treatment intervention, and then a comparison 4 session intervention. At follow up, the treatment intervention group demonstrated successfully significant fewer and partial PTSD diagnosis than comparison group. This is a chart showing us that children who receive CFTSI were 65% less likely to meet full criteria for PTSD. 73% were likely to meet partial or full criteria for PTSD. Recent outcome studies support this intervention. It says 2011 In 2011, a study of 64 participant caregivers revealed 96.7 satisfaction, and this program is rated 3 for promising research evidence. When asked if they had a friend or family dealing with a similar situation, would they suggest that he or she try CFTSI? And 98.4% said they would. CFTSI reduces discrepancy between parent and child report of post traumatic stress symptoms. Program costs. So, to ensure successful implementation, support should be obtained from the parent and the child. There should also be materials required that include the measures and copies of the parent and child handbooks, and there are no equipment requirements. Basic training, $3,000 per day for a total of $6,000 plus the cost of travel for the trainer for up to 30 participants. Additional training in support of the implementation of the trauma informed treatment should be obtained, and this includes a twice a month for 6 months for a total of $200 per call for 15 participants. The strengths are that it is effective in the short term, improves family communication, or offers a seamless introduction to longer term treatment and to mental health interventions when needed. The limitations are the youth has to have a family support that is supportive, and also it can be expensive for individual clinicians that want to become trained in this. So, this seems to be a very promising treatment and is endorsed by multiple child advocacy centers. And it is also a part of the Substance Abuse and Mental Health Services National Child Traumatic Stress Network. If you need more information, you can contact the trainer, which is Carrie Epstein, or the program developer, which is Stephen Morans. Thank you guys for your time and enjoy the rest of the winter break.